Hello everyone, this is Dr. Pritpal, MBBS MD from CMC Ludhiana, and it has been a long time since I posted my last video that was on the study design. And so I thought now it would be an appropriate time to go ahead with the other aspects of methodology section in the research study in an original research article. So based upon those aspects, I thought that today I would be talking about selection criteria and I hope that I'm able to solve to an extent certain queries that are there. And if at all there are any queries that are there uh, from your side, it would be welcome. You could always put those queries in my chat box and I would be happy to get back to you. Now, what I started was I started in the previous session, I started with the methodology section. And before we go into the methodology section, we have certain other aspects that we need to take care of. And these aspects are that we are talking about. Now, what happens is that the learning objective in this particular session would be that it would be upright or appropriately said that by the end of this particular session, you could be able to enlist certain selection criterias for a study design, and maybe you can think of a process of how to go ahead with the selection criteria. Now, before I go with the selection criteria, it is pertinent or it is very apt to go ahead with the introduction, and this introduction is right from the beginning. It is the same introduction, and I would like to stick to one particular format that is there, and that is the format that I would always like to stick to. So I stick to that particular format, and we proceed ahead with this particular format, and we go ahead with the introduction. Now, whenever we talk about introduction, it would be right if I talk about the research process. Now, research process is a particular process where there are a series of steps or actions that are required or are necessary to carry out an effective research. And one of the things that you need for a research process is you need to have a hypothesis or a research question, which is the central or essential component of research. Now, for a good research question, you should follow the FINER criteria. That is one of the possible criteria that you could follow. This FINER criteria means that F is feasible, I is interesting, N is novel, E is ethical, and R is relevant, which is also known as FINER criteria. The other criteria, which is quite popular and commonly used is the PICO format. The specific research question should be formulated based upon the PICO format, and this PICO format, P covers population, I covers intervention, C is the comparison group, and O is the outcome of interest. And sometimes T is added to take care of the timing. For particular example that I have been giving from the past few sessions is that for a patient 65 years older, that is the patient population, we need to assess the usefulness of influenza vaccine, that is the intervention that we are talking about, as compared to the non-vaccinated population. So that is a comparison group. And what do we want to find out? We want to find out the influence of risk of developing pneumonia. That is the outcome. And we could further add up the T, that is during the flu session we need to go ahead with this. So for any research question, one of the most important thing is that you need to have for all research purposes, you need to have a research question, and these are two particular abbreviations that could help you out for a good research question. Now, proceeding further with the structure of the research. Now, this research, the structure of research, most of the time it follows the hourglass model, where we have the top or the initial point, which is quite broad, we narrow down and then we again broaden up. That is the hourglass model. Now, in the hourglass model, we have the IMRAD model that is commonly followed. IMRAD is introduction, methodology, results, and discussion, where when we start with introduction, we tend to have a broader prospect and we gradually narrow down to a specific area of interest for a particular question or a particular disease question. And then on that particular area of interest, we narrow down to our methods and results, and then we generalized our findings on the various studies that are there. That forms the discussion part of the research process, and this is commonly known as the hourglass model. Now, whenever we are talking about the various sections that are there for material and methods, these are few of the things. Not necessarily it might be seen in all cases. Necessarily it might not be seen. There might be few components, or there might be more than one components, more than these listed out here. But I tend to fix myself to certain criterias which I find quite helpful for a study. For the methodology section, we start with the study design, we go with the study population, the selection criteria, the inclusion and exclusion criteria that comes under selection criteria, the procedure, the parameters to assess outcome, and the statistical analysis. Uh, in one of the previous sessions, I had talked about the study design, and I highlighted the various study designs that are possible with this. And now we come to the study population. The study population is obviously, it could be depending upon the area of interest. That particular area could be the study population. And how do we select the study population? That is where our selection criteria comes into picture. Now, this selection criteria consists of an inclusion and exclusion criteria, and most of the time you might find this particular statement: all the particular participants who fulfill the inclusion and exclusion criteria would be a part of our research. So what is this inclusion and exclusion criteria? So inclusion criteria is we'll tend to include these many number of patients, and when we talk about the exclusion, out of these, maybe if we are talking about a disease X, and we say that all patients suffering from disease X would be are included in the study. Now, in this disease X, what is the further subpopulation or a population that I would like to study? In this situation, I would go for various things associated with this particular disease X that I can exclude out. Like, I would not like to have any comorbid condition. I would not like to have any uh, concurrent administration of drugs that could be given in this particular situation. So all these things come under the exclusion criteria. Now, the more elaborate your inclusion and exclusion criteria is, the more good your research question or your research process comes out to be. And this research process, almost all the original research, whether published in various journals or maybe published anywhere else, what you'll find in all these research processes, you will find a section on selection criteria. Now, what I'm going to do out here is, I thought maybe I would tell you what an inclusion and exclusion criteria is, but a better alternative that I found out was to look into, because most of us do tend to follow the various medical journals that are there. So I looked into some medical journals, some reputed medical journals, and in those medical journals, I looked into the inclusion and exclusion criteria. And that is my purpose out here, that I would try to highlight these inclusion and exclusion criteria depending upon the study that is there in the picture. And then I have certain examples from a particular site that is which is a clinical registry site for US. And in this particular registry site, all the clinical trials that are done till date are registered, and they give an exhaustive list of inclusion and exclusion criteria. So these journals and these registry site, they are a way, they help us out to go ahead with our study in helping us select what particular group of population we would like to include in our study, and what particular group of population we would like to exclude out. So this would be my focus out here. Now, be it any study. Now, when we are talking about a medical research, we have been highlighting this particular aspect also, that there's an observational study and an experimental study. For an observational study, it could be uh, to find out the prevalence or incidence, where we go for a cross-sectional study or a longitudinal study, or we want to provide an association where want to know for a cause and effect phenomena. We are including a comparator group. That could be a cohort study or a case control study. And then we have the other aspect, that is the clinical trials. This could be prophylactic, therapeutic, or intervention. Prophylactic, you want to check efficacy of a vaccine, you want to go for check for a treatment, or you want to look for an health service, you are giving an intervention. So that is an interventional or experimental study, and their ethics committee has its role. So maybe in one of our sessions, we could even talk about the working of an ethical committee, how a particular ethical committee works according to our recent guidelines. So at this moment, what we are going to do is we are going to look into the selection criteria, and we'll be looking at selection criteria of certain original research from maybe NEJM, the Lancet, BMJ, and so on, so that we could have some amount of clarity, and maybe we could focus on these. But whenever we are trying to study, whenever we are trying to focus on a research question and we look for literature, we could look for these selection criteria that could help us out in defining our inclusion and exclusion criteria. So I start with a study that was published in NEJM. Now what you'll find is this particular study is published in March 11, 2021, just a recent one. And this is an original article that is there for a neutralizing monoclonal antibody for hospitalized patients with COVID-19. And what is, but this is a neutralizing monoclonal antibody, and it has been found to decrease in viral load and so on. And when I went to the details of this particular study, this is again the part of this particular study, I went into the patients, and now here we have the inclusion and exclusion criteria. So what is the inclusion criteria out here? We have underlined this. So what they say is that we enrolled adult patients, that means more than 18 years of age, who had documented COVID-19 infection, and the duration of symptoms were attributable to COVID-19 of 12 days or less. So this is the inclusion criteria. Inclusion criteria is you have patients that are adults, you have patients who are having COVID-19, and we have fixed a duration of 12 days or less. Now, this would form a broad group. In this group, what are the patients that we would like to exclude? So from this trial, we would exclude the patients who have received intravenous immune globulin, because then you will not be able to get this, have received convalescent plasma, or have recovered, or other neutralizing monoclonal antibodies. And then further, they have highlighted that during stage 1, patients were excluded if they had end organ failure, or had new renal replacement therapy, or receipt of invasive mechanical ventilation, extracorporeal membrane oxygenation, or mechanical circulatory support, or certain extra pulmonary complications. So what is the purpose? The purpose out here is that we are trying to check a new monoclonal antibody, and we want to see that whatever results we get from this monoclonal antibody are attributed to the drug only and not to any other therapy that was given concurrently. So that is why we refined our criteria, and this is generally followed in almost all the new drugs that are any clinical trial or new drug. We want to highlight the aspect that all the changes that have been brought about by this new drug only and no other method. Moving further, I looked into the BMJ, and I got a systematic review and a meta-analysis, and this was also published just recently on 10th February. And the title of this particular research paper was that it was an association between antihypertensive treatment and adverse events. They went for a systematic review and meta-analysis. So as told earlier in one of my previous sessions, that systematic review or meta-analysis is when we are combining all the RCTs, and if we analyze those RCTs to get a best evidence for practice, that forms a meta-analysis. And if we don't analyze it, it's more of a review the best practices that are available to us. So there is a specific selection criteria. Now this is all the studies that have participants 18 years or older, compared individuals receiving antihypertensive treatment only single agent with either placebo or no treatment. So what they are trying to do, the meta-analysis says that they want to study those particular RCTs where patients more than 18 years of age were given. They were on an antihypertensive with a single agent, and the comparator group did not receive any treatment or received placebo. And what did they do? What did they exclude? They excluded the specialist population, children, pregnant women, and they also excluded the case report, case series, or before and after studies. So these were the studies that were excluded, and they only tried to include those studies where any adult patient that was there and he was given one treatment. If it was given in the pregnancy, they excluded this. No, we don't want to include it. Or if there was a case report or a case series, they didn't want to go ahead with that particular case series. Then coming to the site by the FDA, where the clinical trial registry, we also have a clinical trial registry of India that is being taken care by the DCGI. This is the clinical trial registry of FDA, and what I've done is I've talked about 4 diseases as such. Some have a specific inclusion criteria, some have a specific exclusion criteria, some have a broad inclusion exclusion criteria, and some do not have. Some have a narrowed or skewed inclusion exclusion criteria. So just this is just to help you out to know how you could define your inclusion and exclusion criteria based upon the research question that you're trying to answer. So this is one of the studies that was done for diabetes, and it says that this study was for the effect of administration of small doses of thyroxine on glucose and lipid metabolism in type 2 diabetes mellitus. I'll not go into the details of the nitty-gritty what all is there in this particular study. I'll straight away, because my focus is on inclusion and exclusion criteria, so I come to the inclusion and exclusion criteria. Now for this particular criteria, they said that the ages were 18 years to 65 years, adults or older adults, both the sexes were eligible, and they also accepted healthy volunteers. Now, what is the inclusion criteria that they wanted to follow? Healthy or treatment naive. Healthy is under no treatment, or treatment is just starting new therapy of type 2 diabetes euthyroid subjects with a micronodular texture of thyroid gland. They were recreationally active and had a stable body weight and died during the last 2 months. What did they want to exclude? Any systemic disease, any medication therapy, and diabetes complications. So they wanted to only include the effect of thyroid. So that is why they excluded every other thing. They only wanted to look into this structure of thyroid with the glucose and lipid metabolism. Going to another study, and this study is again from the same site, and it is hypertension management in clinical practice. This has a very broad inclusion and exclusion criteria, and very simple inclusion criteria is all hypertensive patients. Exclusion is patients who do not have hypertension. Because what are they trying to study? They are trying to study the hypertension management in family practice. They do not have any subgroup. They are broadly going ahead with this particular study. The third study that I've took into this is for rheumatoid arthritis, where they are comparing 2 drugs. One is tofacitinib and methotrexate as first-line DMARD in the treatment of rheumatoid arthritis. So we have 2 groups. One is the comparator group. The other is the study drug. The other is the comparator. Methotrexate is the comparator, and we want to compare it with tofacitinib. And again, we go into the details of this particular criteria. The inclusion criteria: any patient more than 18 years of age who fulfills the criteria for rheumatoid arthritis as per ACR or Euler classification, and who has a CRP of more than 5.1. What do we want to exclude? For all these patients who fulfill this criteria, if any of these patients has a systemic infection, or has a hemoglobin less than this, or a WBC or a neutrophil or a platelet count less than this, uh, has taken a live vaccine within 3 months, a GFR or less than 50 milliliter per minute, and ALT of more than 2 times the upper normal limit, and pregnancy would be excluded from the study. Again, what we are trying to do, that any result that we get from this particular study would be attributable to either of the 2 drugs and not to any underlying disease condition, or maybe a other drug that is being concomitantly given. Then we talked about this particular, the third trial that is there, that is a trial on asthma. So this is efficacy and safety of flamboyant 125/12 association in the treatment of adults with moderate asthma. And so the treatment out here is asthma, and this particular study has given a lot of, it has taken care of a lot of criteria for inclusion and exclusion criteria. I'll highlight those inclusion criteria. So inclusion criteria is first of is that ability to confirm voluntary participation and agree to all trial purposes by signing and dating the informed consent form. Participants more than 18 years of age, diagnosed with uncontrolled moderate asthma, and with a forced expiratory volume in first 1 second of more than 60% of the predicted value. What would be the exclusion criteria? Any clinical or laboratory finding that, in the judgment of investigator, may interfere with the safety of research participant, known hypersensitivity to the drug, history of alcohol or substance abuse within 12 months to screening visit, current smoking or smoking history with 10 packs per year, participants with untreated oral candidiasis, pulmonary disease history, patient participants with a history of acute asthma exacerbation, RTI, or hospitalization for asthma in the last 4 weeks, known HIV positive patients or with active hepatitis B or C, current evidence of history of uncontrolled coronary artery disease, congestive heart failure, myocardial infarction, or current medical history of cancer or any other medication that would affect on bronchospasm. So what we are trying to do out here, a drug that is under study, any contraindicate to that particular drug would be an exclusion criteria for this particular study. So this is how we go for the the selection criteria. Again, I would come back to what I started with, that there is a research question. We should have a good research question. You could have a good research question that would help you in good research. And one of the essential parameters is the selection criteria. How elaborate is the selection criteria? And for a good research, you should have a clear research purpose. You should have elaborate research procedures, a clear study. You should have clear design and limitation, valid and reliable data. It should be systematic, logical, empirical, and replicable. So with this, I come to the end of this particular session, a small session on selection criteria. I hope that to an extent, I have been able to somehow clear your doubts. And if there are any other queries that are there that you would like to highlight, you can send me in your chat box and I would definitely get back to you. And I hope this has been a good learning experience for you as well as for me. Wishing you all a very happy learning and a safe days ahead. Thank you very much.